Hi. So let's talk about very briefly about the surgeries that's done for corneal diseases. So really, there might be more than two types of cornea surgeries, but we're going to focus on the two main types. And one is the LASIK surgeries that everybody knows, and the other is the penetrating keratoplasty. Let's start with the LASIK, since everybody knows that. Now, of course, the LASIK surgery here, its idea is basically cosmetic, really. Nowadays, from ophthalmologists, for a lot of the doctors I met, they tend to say that LASIK is, if you don't want to wear glasses, do LASIK. That's really its usefulness. So it's really used for cosmetic, whereas than medical nowadays, and with improvement in the laser technology, it becomes more apparent, even more so. So really with LASIK surgery, what we need to know is that the idea behind LASIK surgery, and you should look at videos. I'm pretty sure everybody looked at videos with LASIK. The idea is that they'll cut a flap. They'll use a cutting tool to cut part of the cornea, create a flap, and then apply a laser into it. Once they apply the laser into it, then they will restitch the flap back to its place. Actually, they won't even restitch it. They will just put it in its place and it will heal on its own. And then the whole procedure will just take 5 minutes. The idea is that this LASIK procedure will improve the visual acuity almost immediately. But even still, even with an improved visual acuity, patients with LASIK surgery will still need to wear a form of sunglasses because they will be very sensitive to bright light, and it might ruin their vision or irritate them very early on. So that's the idea about LASIK surgery when you look at videos. And the advantage is that it's painless. It's quick and painless. Very quick and painless. You don't even feel anything. But the disadvantage, and you'll see this in people with LASIK, they might complain of dry eyes. Their eyes are very dry. That's why a lot of ophthalmologists, they give them eye drops, really ointments in their eyes for any dry eyes. And also night vision. Some people complain of night vision for the LASIK, but typically it's painless and it's safe, and it's really useful if you don't want to wear glasses anymore, like me. And of course, there are indications, general indications, however, you would need to know for LASIK surgery. Not everyone can do LASIK surgery. For example, LASIK has to be done for people 18 and above. But really, according to most doctors, ophthalmologists, it's preferable that you do it like 22, around my age, or 25, where your vision is stable, because they will have less chance of complications occurring. Besides that, you also, since we're talking about stable, you have to have a stable refractive error for 2 years. You can't have a refractive error that's constantly changing or constantly unstable. You have to have a constant refractive error, a constant prescription measurement for 2 years wearing glasses before they even do the LASIK. Because if you do it, you might go into problem if you notice that his refraction, he has a refractive error that's constantly changing. All right? So you have to have a stable refractive error for 2 years straight. The third thing is the corneal thickness. That's something people may not know. The cornea of yours, the cornea, if you're going to do LASIK, it has to be thick enough. And there's a device that measures the corneal thickness. I believe it's called pachymetry. It's called pachymetry, where they basically measure the thickness of your cornea. If it's 500 and above, they can allow you to. But if it's thin, let's say 450, then no, they don't recommend LASIK surgery at all. But they might tell you that you can use penetrating keratoplasty instead. So that's one thing. The corneal thickness has to be 500 or more. Besides that, you have to have a normal fundus exam, meaning your retina, your optic disc is all normal before they even perform the LASIK surgery. So these are the uses and the disadvantages and the advantages of LASIK surgery, as well as knowing the idea behind the thing. And that's pretty much it for the LASIK. Now, compared to penetrating keratoplasty, a lot of doctors, they tend to recommend this over LASIK nowadays. They tend to say it's a lot safer. And the idea behind penetrating keratoplasty is that this one doesn't include laser. Not really. This one really doesn't just include laser. It includes a corneal transplant. They take a cornea from a dead donor, a healthy individual, doesn't have hepatitis or AIDS or anything. They take a corneal graft, healthy one, and basically what they do is that instead of creating a flap, they'll have a laser and create a surgical ulcer. They'll basically burn some of the epithelium of the cornea and then insert their corneal transplant in. And then from that point on, maybe a bit of suturing if need be. I don't believe it does, but by that point on, you implement your cornea and safe and sound, you're good to go. But of course, the advantage for this is it's safe for thin cornea. If your cornea is thin, patients or doctors, they tend to recommend keratoplasty. But of course, the disadvantage is that people who do the keratoplasty, they suffer from very severe eye pain. They might come from the surgery suffering from very, very severe eye pain that they have to tolerate for at least 2 to 3 days because you were burning the corneal epithelium. So it takes time for this epithelium to heal. So that's one disadvantage. They might have severe pain for 2 to 3 days. But the uses for keratoplasty doesn't necessarily have to be refractive. It can be for corneal diseases, anything. If you have a case of keratitis, it's advanced, you could do keratoplasty. If you have advanced or late stage of keratoconus, conical protrusion of the keratoconus, you have to do keratoplasty. Fungal keratitis, most likely keratoplasty. مثلا, if you have a ossification of the cornea for whatever reason, keratoplasty. مثلا, if you have trauma related to the cornea, let's say you have a traumatic keratitis, you have keratitis due to trauma, and it was very severe, you might have to do keratoplasty. If you have a case of hyphema, which is blood in the interior chamber, like this essentially, okay? This one right here. This black is the red, the interior chamber from the front. And let's say this hyphema obviously mainly comes from blunt trauma, all right? So let's say it comes from blunt trauma, and let's say there is accumulation of so much blood that it stains the entire cornea, all right? It stains the entire cornea, and you have secondary glaucoma and rebleeding and all that stuff. But let's focus on the staining of the complete cornea from hyphema. If you have this case, you have to do keratoplasty. There's no other way, okay? So that's one indication, like anything to do with the cornea, especially advanced cases. So anything you talk about corneal diseases, they always put keratoplasty, especially as last case scenario or in advanced cases, okay? That's pretty much it for the keratoplasty. You want to know the differences between the two, the advantages and disadvantages, what is the idea between the two, and most importantly, at the very least, know the indications for LASIK surgery, okay? That's pretty much it.